and what happens when you treat it, and how it presents over the course of a lifetime. At its core, we have a brain that's really busy that just doesn't stop, and it's like having 100 tabs swirling around all the time. It doesn't turn off, and it can be hard to get to sleep. A brain that's as full as ours often means that stuff falls out, so our short-term memory is kind of crap, and we are often likely to forget what the hell you just said, or what the hell we were doing, or like where the hell we were going, or where we put the thing. We struggle with regulating our attention, and we often don't have enough bandwidth for what we're thinking about and the less interesting stuff that's happening out there. So we can actually seem sometimes really self-absorbed and just head off in the clouds, and why the hell aren't you listening? We do struggle with impulse regulation, so we don't park the thoughts super well. We can jump around from one task to another and then not actually finish any of them, and it's very frustrating. And when we get frustrated, we are really, really frustrated at ourselves, but also at you if you point out the dumb thing that we've been doing over and over again. We do struggle to organize those thoughts, very hard to work out which of the 100 things we should be doing. So we can sometimes, very often, easily feel overwhelmed and indecisive and just seem like we're just doing whatever, which we sometimes are. We struggle to also, what ties it all together is our starter engine is just kind of crap. We put off stuff until we have to psych ourselves up so much to do anything that's boring or tedious. It's easy if we like it, but we put it off until a hard deadline and anxiety forces us to eventually do the thing. But that is a much less functional way of doing things than just doing it. What's the cause? It's a highly heritable condition. 77% chance that you'll pass it on to your peers, so it tends to be multi-generational, and we know that there's about 43 different phenotypes involved. And it's a combination of the genes plus environmental factors, and those environmental factors are not sugar or computer games so much as things that happened in utero while brain was developing. So advanced maternal age, prematurity, low birth weight, hypothyroidism, gestational hypertension, or any perinatal mental health issues can really increase the risk you're going to have for a child with ADHD. A lot of conditions are associated with these 43 different phenotypes, in particular other neurodevelopmental disorders which have a very high comorbid rate, in particular autism spectrum disorder, which is an 85% co-occurrence rate. We see a lot of epilepsy in our cohort. You should actually screen anyone with epilepsy for ADHD. Parkinson's disease is another dopaminergic neurological problem, also has a high comorbidity rate. We have, weirdly, a lot of atopy in our cohort and a lot of immune cluster conditions like psoriasis, spondyloarthropathies, inflammatory bowel disease, autoimmune thyroiditis, and celiac disease. We see a lot of sleep disorders, in particular delayed sleep-wake cycle insomnia and sleep apnea, and a lot of mental health comorbidity and joint hypermobility disorders. And the natural history is not benign. It is not a lifestyle condition. It is not on trend. If you miss it, you are condemning a person to some lifelong struggle, impairment, and suffering. And the longer that you wait to intervene, the worse things get. We have a reduced life expectancy as a group of up to 9 to 13 years, mostly because of mental health, cardiovascular comorbidity, and accidents. If you understand an impulse and emotional control disorder, then it's not surprising some of us eat our weight in feelings, and we can get very, very big and suffer the complications of becoming very big. We, as a non-self-aware, impulsive kind of cohorts, sometimes we accidentally get injured. We have much higher risks of transport accidents, traumatic brain injuries, and 30% higher risk of accidental death. Mental health comorbid rates are huge. 2/3 of our kids and 80% of our adults will have at least one other mental health disorder, and the most common of them will be anxiety, which is about 50% of all ADHD people, but we also see 5 times the rate of psychosis, psychotic spectrum disorders, a dopaminergic problem, and bipolar disorder has a 20% co-occurrence rate with ADHD. When life doesn't go to plan, we often self-medicate, and we have a much higher rate of eating disorders, in particular binge eating, and substance use disorder, in particular cannabis, but also smoking and alcohol. And we are much, much more likely to try to commit suicide, 4 times more likely, 6 times more likely to succeed. And that's really as a result of a lifetime of educational and occupational underachievement and not setting out, not achieving your goals that you set out to do at the start. We're 4 times less likely to finish school and 6 times less likely to attend tertiary education. And if we got all through that, compared to a neurotypical peer of equivalent intelligence, we're 40% less likely to earn the same as you do, mostly because we will not progress at the same rate, or we'll stuff around and jump from nonsensical career decisions as we get bored of whatever the hell we were doing before. And for those of us that are not so smart, we end up often facing difficulties with the law, and we're much more likely to end up in jail. Women in particular have a startling, scary kind of odds ratio of 7%, odds ratio of 7. A woman with ADHD is going to be in jail compared to a neurotypical equivalent. And the economic impact on society is enormous. Before COVID, it was $20 billion, Deloitte's estimated on a report. And that is a really expensive and serious public health problem. And that's from high health and education costs and underemployment and crime and early death. And the sad thing about it, it's one of the most treatable conditions we have in the entire book, because when we do treat with medication early on, it switches on our brain, the lag is gone, suddenly we can perform like the rest of our peers, and then it basically allows our brains to catch up and the doors of life to not be closed on us, and opportunities to remain from childhood, remain through to adulthood, and the natural history basically reverts to just normal.